Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and welcome to the biggest and best breakfast show in the world. It's Good Morning Doctor Day, and today we welcome not one but two doctors. Dr. Zena Lim, adult and pediatric eye surgeon from Parkway East Hospital, as well as Dr. Mei-Yi, pediatric ENT surgeon from Parkway East Hospital. Good morning, doctors.
Morning.
Good morning, ladies. It's not very often that Glenn finds himself surrounded by 5 women.
I like it.
Yeah, he loves it. Okay, doctors, let's kick it off. We're going to talk about protecting our children's ENT and eye health. So maybe we start at the beginning. What are some of the most common ENT and eye issues among children in Singapore, and what kind of factors contribute to them? Perhaps since you're sitting next to me, Dr. Lim, you could answer that first.
Okay, so what we commonly see are problems of myopia in children, lazy eye, which can be due to various causes, and sometimes we see eyelid issues, allergy issues in children. These are more common eye conditions in Singapore.
What causes a lazy eye? Because our ex-partner, the Flying Dutchman, I always felt like his left eye was a little lazy.
Yeah, so lazy eye can be interpreted by most people as, a bit of an eye misalignment. Sometimes people say that the eyes are lazy because there's an eye power asymmetry. So like in the glasses, your eye power may not be symmetrical or it's unusually high. But typically, lazy eye can be due to various reasons. So most commonly, it's misalignment. Secondly, would be some kind of a glasses power issue. And then, of course, less commonly, if you have a droopy eyelid, say in a child, where the eyelid blocks the vision, then that eye can become lazy as well.
Right.
Oh, right. Okay. And are all these things kind of like fixable? Lazy eye and droopy eyelids?
Yeah, so if it's eye misalignment, sometimes we do various treatments, like we start off with patching. We sometimes do eye exercises to train the alignment. And then, of course, failing which, sometimes we have to resort to surgery to realign the eyes. And if it's droopy lids, then, of course, when they reach a certain age where, they are good for surgery, then sometimes we offer surgery, especially if the lazy eye is not getting better. Sometimes we patch the good eye to make the child use the droopy eye more, so that they're forced to lift the lids to see better.
Like exercising the eye.
Yeah, and of course, if you have a glasses issue, sometimes as young as 2-3 years old, we may even have to give glasses. Yeah.
Dr. Loh, do you concur?
Can't comment on the eye.
Any other common ENT issues?
Well, common ENT conditions that I encounter in my practice, maybe affecting up to 25% of the childhood population, would be nasal allergies, or what is termed allergic rhinitis. And this is sort of like a hypersensitivity reaction to environmental allergens that cause your nasal linings or your sinus membranes to be inflamed. And another common sort of related condition is the spectrum of sleep disorders, ranging from like snoring to obstructive sleep apnea. And this is also contributed by poorly controlled allergic rhinitis, a blocked upper airway from large tonsils and adenoids, particularly in children, and just like poor sleep habits.
So it all stems from the nose?
Yeah.
Wow, okay. Let's talk more about your nose then.
Yeah, some people say I snore.
Yeah, some people
I've
say.
been told, yes.
Okay, you don't think you do?
Well, okay, I'm going to ask the doctor. If I'm if I have a problem in that area.
Okay.
Okay. We'll talk about that a little bit more on the Big Show TV. Meantime, here's Declan J. Donovan with Hungry Heart on Kiss 92. Okay.
Yeah, so Dr. Loh, the issues that you were talking about all seem to come from the nose. Is that the most problematic area? Because you do ENT.
Yeah. I mean, when we're talking about allergic rhinitis, it's really a sensitivity reaction of the nasal linings from inhaling environmental allergens. And then that sets off a sensitivity response.
And it hits everywhere.
Yeah, correct. So Well, in children, sometimes they go for a long while undetected because the symptoms are quite similar to a common flu. And these children just don't complain very much.
Okay.
But
Those are good children, the ones that don't complain too much.
yeah. But what you might observe is really symptoms like a blocked nose, nasal congestion, watery, itchy nose, itchy eyes, sneezing bouts, and then post-nasal drip, and then they sometimes get a throat clearing sort of habit or chronic cough. Yeah.
All right, and back to, before we go back to the eyes, I just want to ask you, like, for someone who snores like really, really badly, does it mean the person has sleep apnea?
It's highly likely.
Okay.
It's one of the presenting signs and symptoms of obstructive sleep apnea.
And what would be like some of the symptoms someone who suffers from sleep apnea has?
So sometimes if it's bad, they can actually, suffer pauses in their breathing during sleep. Or you have a very disturbed sort of sleep, disrupted sleep. You can even, wake up from your sleep. And then some people get tooth grinding.
Okay.
In children, sometimes they suffer bedwetting. And then all this manifests as daytime symptoms of tiredness and lethargy. It affects their school performance. And in children, they can get behavioral issues and even growth delay.
All right.
Yeah, because if you don't, sleep is so important, right?
Yeah.
You were, Dr. Zena, you were saying, Dr. Lim, you were talking earlier about myopia. Now, I read once that Singapore has the highest number of myopic cases in the world. Are we still right on top?
Yeah, we're still right on top.
So what causes the myopia and how can we fix it?
Yeah, so I think number one is genetics. Essentially, Asians are just more prone to getting myopia. Number two is just our highly urbanized environment and the lack of outdoor time. So actually, outdoor time has been shown to be very important in sort of reducing the rate of progression of myopia. And of course, I think what happened during COVID was that everyone was stuck at home, kids were on school, home-based learning. And during those 2-3 years, we really saw an epidemic of, rapid myopia progression in children. So that actually reinforces the fact that if you're spending a lot of time doing near work on devices, that can really rapidly accelerate our myopia progression.
Okay.
And also, there are many studies done where, even if you compare similar ethnicity populations, like Chinese population in Singapore versus Chinese population in Australia, our rates are just higher because we live in a highly urbanized environment. Our kids don't get enough time outdoors.
So it's a combination of those two.
But of course, genetics plays a big role as well. But it's just the fact that we are prone to it, and then on top of that, we don't have ideal environment kind of stimulation, and therefore that's why we see such high rates.
Is there a recommended screen time for
usually
for the kids?
There are some guidelines where, if you're under 5, you really shouldn't be doing maybe more than even half an hour a day.
And the government came up with all those guidelines about under 18 months, zero time on screens, right?
Correct. So, usually what I tell my patients is the less the better.
Yeah.
Yeah, but we have such high rates, like 80% of our army boys are short-sighted. 80%.
Is it fixable? Like through LASIK and stuff like that?
Yeah, so there's a common misconception that, LASIK can kind of get rid of the myopia. It's true to a certain extent, but it doesn't sort of treat the underlying eye health. So when your eye is myopic, you end up with more downstream problems like cataracts, glaucoma, retinal detachment. So people who are highly short-sighted, later on in life, they can develop a fair amount of myopia-related eye issues. And essentially, that's what we're trying to prevent. We're not trying to... of course, keeping your power low is good for day-to-day convenience, not having to be super dependent on your glasses. But the whole push towards myopia control is to actually prevent the downstream effects. And therefore, a lot of parents, some have the misconception that, if, it's okay, even if you're 800 and at 21, I'll just send my child for LASIK.
Yeah.
Yeah, sure, that's correctable with refractive surgery these days, but it doesn't prevent the sequelae.
Later on.
Yeah, but if you can arrest myopia at an early stage and you keep your eye power, say less than 200-300, then generally the eye is healthier. And then as an adult, as an older, adult, you have less problems.
Right.
Okay. All right.
Yeah.
Are we going back on air? No,
We are going
not yet?
back in
Yeah,
about
almost.
a minute. Yeah. So we'll have the next question about allergens.
Yeah.
Because you spoke about environmental issues and stuff like that. So we'll talk a little bit about that when we go back on air.
Stand by.
Kiss 92 traffic.
Okay, if you're on Jurong West Street 51 heading towards Street 52 right after Boon Lay Way, look out for an accident. Other than that, it's the usual peak hour traffic that you need to look out for. Let us know if you spot anything. It's 88550920.
Good morning and welcome back to The Big Show and The Big Show TV. Our doctors this morning are from Parkway East Hospital. We have Dr. Zena Lim, who is an adult and pediatric eye surgeon, as well as Dr. Mei-Yi, pediatric ENT surgeon.
So my next question would be for you, Dr. Low. You deal with ENT, and you were talking about environmental allergens. How kids these days they start to get they start to sneeze because of allergens, and then their eyes start to water, and then their throats start to act up and all that. So when you talk about allergens, are you talking about at home, outdoors, pets, construction, smoking? Like what sort of allergens are the most common these days?
I think the most common offending allergens would be found in the household, and these include like house dust mites, cockroach mix.
Cockroach.
What's cockroach
It's
mix?
like sheddings from the cockroach, and
gosh.
then mold.
I think your house will have a lot
Oh,
of that.
stop. Why my
Angel.
house? Why
'Cause
not
it's
yours?
exposed.
Oh,
Insects were flying in the last time when we went there
insects
for a
were
party.
flying in when you were there?
Right?
No. What
No.
insects?
Was it
no.
a cockroach?
No, it was never a cockroach.
Okay.
No, my
Yeah,
goodness.
it's
What-
really everywhere.
Oh my gosh.
And then, with increasing pet ownership, you have people with pet fur allergy or pet dander.
Yeah.
And I think in the local context, things like tree pollen or grass pollen is less relevant.
Then the indoors.
Yeah, because we don't have 4 seasons, in Singapore.
So you're safer outdoors than you are indoors?
Yeah,
Wow.
I would say that. So a lot of the times, children get triggered by the allergens where they spend a lot of time, which is in their bedrooms and in the household. So all these like house dust mites, everything, they're found in the bed linen, in your upholstery, in your carpets, and soft toys.
Soft
bed,
toys.
Yeah. Doctor, she's got a golden retriever, so fur is all over her
Yeah.
house.
And I don't sneeze once.
Yeah, but one day she will develop asthma.
Oh, well, my goodness.
That's what my
Hopefully
mom
you're not
always
allergic.
says. It's like, don't breathe in the dog fur, huh? Because I used to have, I still have a Jack Russell Terrier.
Yeah.
Yeah.
And he sheds quite a bit.
Yeah.
And my mom was always like, please, don't breathe in his fur.
Is
You'll
that-
develop asthma one day.
Is that a myth that
Yeah, is it a myth?
that people can develop asthma because of a pet, or is the asthma already underlying?
It's underlying.
Okay,
Yeah.
there you go.
So
It's not
you-
because of the pet.
No, I'm
You're
not-
safe.
You go and scold my mom, lah.
Oh no, I want you to
It's
scold
not like
your mom.
I believe my mom. I don't believe in a lot of things my mom
No,
says.
but I think a lot of people think that, right? No, only Glenn. Okay.
Okay, so what conditions can, let's say, a child develop if the child is constantly, perhaps, breathing in
Dust
things
mites
like,
and everything else.
I'm talking about pet
pets.
related, right? Will it be harmful to the child?
I mean, I would say it's only if you have an underlying allergy to the pet fur.
Okay.
Yeah.
Okay.
Yeah.
Then you would react. Yeah.
Yeah, because these days, I mean, parents consider like their pets their fur kids, right? So I've seen like almost like infants, them putting a cat next to the infant,
Yeah.
you know, and sometimes
Sometimes they may already be allergic. Are you born with these allergies though?
No, you kind of
develop
tend
them.
to develop them in the early years of your life.
Okay, okay,
You may or may not develop them. I mean,
okay. All right.
yeah,
Wow.
maybe I'm a bit old-fashioned. I'll
Maybe.
never put like a cat or a dog next to my baby.
I would.
You would?
Yeah, absolutely. Yeah.
Okay.
Stop.
All right, let's continue to talk to the doctors on the Big Show TV. It's 8:21.
Kiss 92 Time Check brought to you by Paediatric.
So dirty putting a pet next to a baby somehow.
My pet is very clean, thank you
I'm
very
not.
much.
You have no babies anyway.
No, that's true.
Yeah, but I'm talking about like some people, right? I mean,
Yeah.
on Instagram we see these things all the time.
Yeah.
It's like the cat going over the child, the baby, and who's in the cot, and I'm like, what's going on here? Yuck.
Well, you have no children, neither are you going to put a pet next to.
Okay.
Okay. What about things like air conditioning? Is that a factor?
well, they need regular servicing.
It's recycled air can't be good for you, right?
Maybe the dust in the vents.
In the vents
Yeah.
itself. Okay. Okay.
You don't know what's in the vents, actually, quite
Yeah.
frankly.
So basically, keep the home as clean as possible, like the
Yeah.
stuffed toys you were talking
Declutter,
about.
remove stuffed toys.
You know what I've heard? I've heard like if you switch on your aircon and you get a foul odor, it means
It
the
needs
filter needs
Yeah,
cleaning
clearly.
or it needs
Ew.
to
gross. What about things like migraines and headaches? Is that linked to eye strain or any issues?
Yeah, certain types of eye problems can give you headaches. So commonly, if you have an uncorrected eye power issue, and usually that would be children or adults who have long-sightedness. So not myopia, but the opposite.
Which is astigmatism, right? No, it's not.
No, not quite. It basically, they see fairly well far, but for near, they need to kind of focus harder to see clearly. It's like the same type of glasses that we give to these people are what people who have lao hua they wear, the reading glasses.
Like reading, yeah, here.
Did you
reading
see
glasses.
the
okay.
magnifying
But children
glasses?
can have this
But
kind of.
she can also see my font size. One word per page.
So sometimes if they are unknowingly trying hard to focus, then they can get headaches and eye strain as well.
And that's a sign that we need to look out for as well,
Yes,
right? Get their eyes
headaches,
tested.
especially when it's triggered by near work or reading. Sometimes when people have alignment issues, so if the eye kind of deviates out and they have some level of control, and they're kind of trying to keep their eyes in focus, that constant, inward kind of realignment can trigger like a kind of eye strain around the forehead, the eyes. Yeah, so that's also another warning sign.
Okay.
And lastly, sometimes if like for ENT, if you have undiagnosed sinus issues, sinusitis, sometimes they come with this kind of frontal face kind of pain. Yeah, so that's also something we look out for, because sometimes they see me and they say that they have headaches, but it turns out that they might be having an underlying ENT issue.
Oh, right, because it's blocked. Is that what it is?
I mean, because our sinuses are located, we have some over our forehead, in our cheekbones, around our eye. So when they're infected or inflamed, you get pressure symptoms that can cause a really bad headache.
yeah.
Are inhalers good? These days you've got those
Vicks and all that.
Vicks or Axe oil and stuff like that. Does that actually, in your professional opinion, help clear the nasal passage? Because sometimes, it does feel good.
I think, it's just the menthol in there that makes you probably feel like it's cooler, but it doesn't, actually
It doesn't do
have an
anything.
effect yet.
Kind of wakes me up.
It just makes you feel good. Yeah, it feels
I
good.
think I have one in my pocket. I always carry one in my pocket. Anyway, Dr. Loh, now many parents also worry about hearing loss, especially with the use of headphones. How can they protect their children's hearing from long-term damage?
Well, if your prolonged exposure to excessive noise levels over time can increase your risk of developing noise-induced hearing loss. And I think in children in this day and age, they're at risk when with the increased use of all their personal listening devices. And then also attending pop concerts and sporting events where you have noise levels that can exceed like 100 to 120 decibels. So WHO sets the noise exposure limit at 80 decibels for no more than 40 hours in a week's period.
Okay.
And 80 decibels is round about like in a crowded restaurant, that kind of noise level, or like traffic noise, or vacuum cleaner going off, that's about 70 to 90 decibels.
Okay.
So for children, we, just as a rough guide, if you're listening to your personal listening device, maybe set it at a max volume of about 60% of the maximum.
Okay, don't.
And for no longer than like 90 minutes
At a time.
continuously in a day.
Okay.
Yeah.
What about things like
She can't hear very well, by the way.
No, I can't.
That's all
What
these
about
Noise
things like
cancellation.
earplugs that still allow you to hear? Because these are becoming quite popular on the market. There's a brand called Loop, and you go to concerts with it, you go to clubs with it, so you protect your ears while being able to hear the ambient noise, but it's not affecting your ear canal as such. Have you heard of those?
Are these the noise cancellation?
No, they're not noise
cancellation.
cancellation. They still allow
Not
you to
earplugs.
speak. They're like earplugs, but they protect your ear. They still allow you to listen to the music, listen to people talking, but apparently they block off damage to the ears. Have you heard of those?
Not what you're talking about
Referring to-
specifically, but I mean, yes, it's something that you can do, like wear hearing protection if you do go, which takes the form of earplugs. Just attenuates the ambient noise.
Like when we go for an F1 race, for example.
Yes, yeah,
That's
for sure.
definitely-
Earplugs.
Yeah.
You can still
Really
hear
help,
your
yeah.
surroundings, but
Yeah.
it mutes
Yeah.
everything.
Yeah, I've seen some like babies at the Formula One, but they've got their
Yeah,
headphones on.
Formula
Wow.
One is really
Yeah, it's really loud.
See,
yeah.
once again, would you take your
No,
baby to
I
a Formula
wouldn't.
One?
Even with headphones, I wouldn't. No, I wouldn't.
Good thing I don't have children.
I would not.
I'll be very overprotective.
But you mentioned noise cancelling just very quickly. Are those
Yeah.
good for us? Because apparently your brain doesn't allow you to listen to particular types of noises when those headphones come off. So it's no longer processing all the kinds of noise we should be hearing.
I think they work in that they sort of cut out the ambient noise
Yeah.
levels, so that it kind of leads to the listener lowering their listening volumes. So that's how they sort of help.
Okay, we're going back on air again. Angel needs to do a traffic update.
Yes.
Kiss 92 traffic.
On the KJE towards the PIE after the BKE entrance of vehicles broken down. Also on Jurong West Street 51 after Boon Lay Way. This is in the direction of Street 52. An accident has been spotted. Wherever you are this Wednesday morning, stay safe.
Welcome back to Good Morning Doctor. It's a lovely Wednesday morning, and we have with us from Parkway East Hospital, Doctors Zena Lim as well as Dr. Mei-Yi. Welcome to the show once again. Dr. Lim is an adult and pediatric eye surgeon, for those of you who are just joining us, and Dr. Loh is a pediatric ENT surgeon.
Yeah, so we were talking about earplugs and how to keep our ears safe and all that. But I want to bring the topic, the conversation back to you, Dr. Lim. We are trying to minimize screen time for children to protect their eyes. But let's say we cannot. Are there any good habits that we can at least instill? Say things like lighting, distance, maybe the brightness on the screen. I mean, what can we do to help our children at least use their screens safely?
So I think the key thing is that if we can't minimize their screen time, like if they have a lot of work, then there's kind of a rough rule that we go by, whereby, if you spend 20 minutes on your screen, then you should be taking a couple of minutes, resting your eyes, and then during that period of rest, to kind of look far and not, rest by looking
Closing.
at your phone or, or reading a book as part of the rest, but you're encouraged to kind of focus far in the distance. The other thing is good ambient lighting. So a lot of times we get asked what kind of lighting, is it a specific wavelength, what brand of light should I buy? But really, we don't really have hard data on what exactly is going to be helpful, but just good ambient lighting, daylight, that makes sense. And then of course not reading in the dark, not reading in the car, not reading lying down, and adequate kind of rest in between those periods of screen time.
I think so many people do that, huh?
Yeah, so you're saying in the car because of the movement, right?
Yeah.
It's hard to
movement,
focus.
focusing, and also you're still kind of staring at something at close range.
Right.
So, yeah.
It's so hard for parents to be role models, right? Because
We're
that's
doing
exactly
that
what
as well.
they do.
I'm
Yeah.
constantly on my phone in the cars and
Yeah,
stuff. Yeah,
but it's not good for the kids.
Correct.
So,
yeah. So very often, the kids in front of me, they'll say, "Oh, but my mom does that too. Why can't I do that?" So I always say that, okay, your mom's eyes are kind of matured. You're still growing, so you need to observe that. But that's the only thing we can.
They don't really care though.
They don't. Yeah, and they'll say, "But my parents do that. So why aren't they harming their eyes as well?" you know? Yeah. And I think outdoor time is so important, but it is just so hard for working parents to be able to find the time to take your kids down for 2 hours a day.
Yeah.
It's just practically difficult. Yeah.
What
Okay,
about-
we've kind of
yeah,
run out of
we
time.
have, yeah.
One last question for both of you to answer. What is the one thing you wish for Singaporeans to take away from today's interview? Let's start with Dr. Low.
I think perhaps to recognize that things like allergic rhinitis and snoring sleep apnea, they're chronic medical problem, which to recognize the symptoms in the child and to seek medical attention if they're there, because with good treatment and control, you can really improve your child's quality of life and health and well-being.
And for myself, I think to kind of pay attention to their children's eye symptoms, like having squinting when they're looking at things, having misalignment of the eyes, and also paying attention to the school health when they do the eye screening for their children. They'll often flag out borderline abnormal cases, and then from there, to take them for their follow-up eye exams, because a lot of times these things can be prevented or arrested at an early stage. For example, myopia. There are lots of things we can do these days in terms of slowing the progression of myopia with eye drops, special lenses, certain contact lenses. I mean, we can really half or even lower the rates of progression by 60-70%. So a lot of times, if you detect it early, then you end up with a better off vision.
Great. So
Thank you
there
very
is
much.
help. Yeah.
Thank you, doctors. It's been a pleasure. We've been speaking to Dr. Zena Lim as well as Dr. Low Mei-Yi from Parkway East Hospital. Thank you so much.
Thank you. Thanks.
Thanks, ladies.
Thanks for prioritizing